Hello, Susie here. Coming back with it's a 6-month update right now for my Kesimpta injections. I'm going to do one here today. I've been seeing a lot of comments thanking me for doing the tutorial, for easing some nerves, for some that have just started or were just about to do an injection for the first time, which I'm happy to ease any nerves. I was a wreck 15 years ago when I had to go do Copaxone and Avonex for the first time with none of this social media stuff. So I'm happy to answer any questions. If you have any, just leave them. I'm not always the fastest at getting back. I don't know how to write back fast or get notifications for it anyway. But so in any case, I'm right at the 6-month mark, and I'm going to have a update appointment with my doctors in the Boston area at the end of the month, and then we'll have another set of MRIs to see what's going to happen in the meantime, if there is any more progression or what. I feel exactly the same. It's only been 6 months, and then this is the time where they say it kicks in. And so I'm just going to start getting more hopeful because my doctors at the appointment, I remember them saying, this is the first medication with the potential to heal some of the lesions. Now, I have 40 plus lesions on my brain, and most of them are greater than like 30 and 40 millimeters. Like, I have a lot of big ones on there. It's not been the happiest road for me. I was diagnosed in like 2006 or 7. I think it was 2006. Any case, so it wasn't the most graceful road for me. After having my second child, my son, in 2017, I took a really hard hit, and I've just been getting worse and worse and worse. So this is like one of the final hopes I have before stem cell, which I really don't want to do. I mean, in the future, which I guess we're in the future. We'll talk about that. Any case, let me start the injection. So we'll do an update. I'm going to do the belly again. So I've been seeing a lot of some people have tried it on their leg. And yes, I think it's a little more uncomfortable in the thigh area. I, although, always like to rotate my injections just because after doing them for this many years, I just have always rotated my injection sites. So I think I did my leg last time. So we're going to take out the mommy pouch, my kangaroo pouch. No shame. So in any case, I think I'm going to do the left side. I think this is what I did with you guys last time, right? And I do the whole stomach area. That way, in case I'm like, you know what, I'm going to actually go over here. So when it comes to injections, they told me at the doctor to inject on my leg. I think, did they have me use my leg or my stomach? I can't even remember now. Don't quote me on that. All right. So in any case, now we have this whole area to work with. But I think what my nurses have always told me in the past, and after being a nurse, when you're injecting subcutaneously, you just want to pick a fatty layer. Like, I don't think it really matters. But I always just do the tops of my legs and my stomach. I've always had problems with the back of my arms. And sometimes in the past with the Copaxone, I have even done the side thighs and then the rump roast back here. We don't have to do that anymore. There goes the box, you know. So we give her a twist. Ooh. And then I think we're pretty dry. Gotta let it out really loose. So in any case, yeah, no worries with this because so much painless. Avonex was extremely painful. It burned after. I would get welts after, like if I got stung by a wasp. And then after a few days, that would bruise. So I was doing that every day. So I would have bruise here, bruise on my legs, bruise on the rump roast. I was bruised everywhere. So this stuff, you know, it doesn't hurt. And even if sometimes, like once or twice, I have felt like a little sting, like maybe the alcohol wasn't dry, but most times it's very, very painless. So we're just going to go ahead. And this is a self-injecting syringe. So you just grasp it. You want to have that window facing you because when it's done injecting, the window will turn green. So you're going to wait for that green window. So you grab a fatty area, just give it a grasp. I like to go an 1.5 to 2 inches away from the navel. That's always what I've been taught. So just give it a grasp and then just push down until it injects. Once it has enough pressure, it'll start injecting, and just hold steady until the window is green. I don't know if you guys heard. I forgot to get a cotton swab. Anyways, I'll use a tissue. I don't even have any area of blood, nothing. So that's what one lovely thing about this injection. See, I've done it. There was no pain. You can't see a big injection area. See, you can just see a little, it's not, but I used to get big red welted areas. So there's none of that with this. And I'm going to put this in the sharps container because it does have a needle inside. So I can just go about my life. I don't have to ice it. I used to have to ice it with the Copaxone. And then, you know, it was a pain in the butt with the Ocrevus to go to the hospital for the infusions. I've been through all the medications. It's been a long road for me, and I'm hoping this is the one. And so being at the 6-month level, this is where it kicks in, where they say it'll kick in and start working. So I'm just going to be more hopeful. I'm just going to try to be, you know, active as I can be, because I can't be too active. But I just definitely wanted to come back and update you all on how things were going. Please feel free to message me here, to leave a comment. I'll get back to you as soon as. I've been checking it more and more now that I know people are actually leaving me a comment. So don't have no fears. The only fear I have with shots now is side effects. It's not the pain now, it's the pain after. Like, I've had some really nasty side effects with the other injections, and I haven't had any really with this. Not that I noticed. Nothing new has been noted on my log. So I'm going to continue to pray. I'm going to continue to do this, and then I'm going to come back. The next time I have my appointment, by the time it'll be like the first of the month, I'll come back again in a month. So we'll come back in a month for my next injection, and I should have had my MRIs and updated appointment. And so we'll have a little bit more information. But if anybody has any worries about anxiety, it's really painless. Don't be.